In this chapter, we're going to discuss biomechanics of physical activity. Looking at the chapter objectives, we're going to describe what biomechanics is and what it encompasses, explain how biomechanics is useful to you in your career in kinesiology and related areas, address what biomechanists and related specialists do, how biomechanics emerged in the field of physical activity, and introduce biomechanical concepts and processes by which biomechanists and professionals in physical activity and related fields answer questions of interest in professional settings. Looking at the goals of biomechanics and physical activity, we're trying to understand how basic laws of mechanical physics and engineering affect the shape and structure and function of the human body. Mechanics is a branch of physics that documents motion, or kinematics, and the cause of motion, kinetics, and to apply this understanding to improve the outcomes of our movements, so things like performance effectiveness, and increase or maintain the safety and health of our tissues. So what is the purpose of biomechanics and physical activity? Our structures help us to function, so examples, breathing, running, texting, eating. So conversely, our movement and our functioning affects our structure. So forces are needed to accomplish any task with movement, and they can help maintain our health and our body structures. A force consists of a push or pull on an object or a body. So some forces that influence body structure and function include forces applied to us by another object, forces we apply to another object to manipulate its motion, and forces acting on a bone. So we'll look at those in the next slide's pictures. In this picture, we're looking at forces applied to us by another object or another force. I'm not quite sure what forces are acting on this guy's face, but acting down on him is gravity, acting kind of depending on the wind direction. The wind is acting on him, and then he has the ground reaction forces when he's landing in the long jump pit. In this picture, we have forces we apply to another object to manipulate its motion. So here we have a female doing archery. So we can look at the forces and directions of forces that she's applying. So she's pulling her arm back to pull the bow back, and then which has force on the arrow, which will then go forward. In this picture, we have forces acting on bone. So again, we have gravity pushing down on the bone. Also, the weight of the body would be pushing down on the femur. Ground reaction forces, so equal and opposite from the force the body puts on the ground, are acting up on the body. And then we have forces within the bones, with muscles pulling both forward and backwards. Looking at how we use biomechanics, we use it to improve movement techniques for sport performance, locomotion, and motor skill acquisition. We use it to improve equipment, prevent injury, guide rehabilitation and treatment. Biomechanics of human movement must account for factors influencing movement that include sensations, other performers, environment, emotions, prior experience, cultural expectations, socioeconomic class, and anatomy. All of these aspects go into movement, such as stomping or acting quickly if you are angry, performing with greater skill because you have prior practice, or perhaps walking with poorer posture due to socioeconomic class. There are two main themes of biomechanics physical activity. One is function, how we produce forces to generate, maintain, or slow down movement during physical activity. And the other is structure, how forces such as gravity affect our body tissues. We can improve performance through understanding mechanical laws. The performance of any person can be improved in almost any situation that involves physical activity. For example, repetitive work tasks, activities of daily living, exercise, occupational or sport training, sport performance, music playing, dance, and even lying in bed. If we understand how living organisms can best exploit the mechanical laws that govern how motion is controlled, we can intelligently select the best movement techniques for a given performer to use in completing a certain movement task. Looking at biomechanics and kinesiology degree programs, most kinesiology programs in our kinesiology program at HBU have at least one biomechanics course. And also some of the principles are throughout other courses, but you will have one main course in biomechanics. And you'll learn to apply the mechanical principles for manipulating movement as well as other principles that can affect tissue health. You'll learn to use practical methods and tools to answer human movement questions relating to assessing or improving performance effectiveness or tissue health, including injury prevention. And most biomechanical assessments and diagnoses made by kinesiology professionals involve qualitative judgments based on observation. So rather than using a measuring tool, you might just use your judgment, such as how it sounds when somebody makes a step, looking visually, how a foot might go out to the left or right. Those are qualitative judgments. So again, when we look at the interlocking or interdisciplinary look at kinesiology, biomechanics works with other subdisciplines. So anatomy, exercise physiology, motor behavior are all crucial to understanding how our body structures produce movement. A kinesiology professional recognizes that our movements are all affected by psychological, sociological, and cultural factors. So what do biomechanists do? They could be researchers, clinical biomechanists, performance enhancement specialists, ergonomists, or human factors engineers specializing in industrial task analysis. This is where people who look at to prevent injury by repetitive work movements. Forensic biomechanists would look at movements and how they might have affected a crime or how a crime was committed. University professors and certified orthotists or prosthetists, fitting prosthetics. This is especially important in military rehabilitation. Looking at the history of biomechanics, the antecedents of the study in ancient world and Renaissance, we had Descartes, Borelli. Biomechanics applications really began in the late 1800s with looking at efficiency of movement by Taylor. Taylor influenced Russian researchers who were perhaps the first to use the term biomechanics, and Posse and Skarstrom were the first to use the term kinesiology in the U.S. in the late 1800s. In the 1920s to 1930s, Ruth Glasgow was instrumental in looking at film analysis and classifying biomechanical movements. In the 1960s, there were a lot of conferences, organizations, graduate level programs started. And in the 70s, there was a rapid expansion moving into sports medicine and dance kinesiology. And in the late 20th century, there was a continued expansion of university programs and the switch from the term kinesiology to biomechanics. So it used to be, even when I was in school, your biomechanics class was called kinesiology class, whereas the whole field was usually referred to as exercise science. So kinesiology was a specific area in the last 10 years or so. It became that we called the whole field kinesiology. Looking at an overview of research methods in biomechanics, Some of the tools we use are cameras, motion detecting technology, video, sensors, smartphones. I did a study using huddle technique for breaking down movement of actually clinical movements rather than sports. But huddle would be one of those devices, if you use that in sport, that you're basically breaking down the biomechanics of your sporting movements. Force measurement devices like transducers, platforms, and EMGs, and computer simulations. Looking at an overview of knowledge in biomechanics, we look at external forces, gravity, ground reaction forces, friction, and fluid forces. Fluid resistance could be wind force, or it could be water if you were swimming, and how they act on performers, how internal forces act on performers, how biomechanical laws of nature shape our movement, so the law of inertia, law of action-reaction, torque of movement, propulsive forces, and fluid forces, and why do we move in certain ways and not others, and is there such a thing as a perfect movement technique? Here we have a visualization of external forces working on an athlete. So we have the downward force of the weight of the body in the chair on the ground, and then a vertical ground reaction force. As he's moving forward, friction is working with the chair, and then we have the wind and air resistance. So there are several sorts of internal forces that can work on your body tissues. They're compression loading, shear loading, and tensile loading. So in the first on the left here, we can see an example of compression loading. So it's compressing the joints, so the body weight's going down, force of the ground reaction force is going up, and that's the tissue loaded is the bone in the tibia in that case. And then in the middle we have shear loading, and that causes the tissue to slide against another tissue. So we have the muscle that pulls the tibia forward working against the femur pulled back. So that's working on the cartilage and the end of the tibia. And then tensile loading on the far right pulls the tissues apart. So here we would have the ligament, probably an ACL or a PCL, that we're looking at with the thigh muscles going forward, and the reaction, the femur pulls ligament with equal force backwards, and that's an example of tensile loading. So our goal using biomechanics is to achieve performance effectiveness and safety. So biomechanists, as well as other physical activity specialists, can apply the principles of mechanical laws to enhance performance, reduce injury, evaluate the effectiveness of a movement, and select the proper type of sports equipment, tool, or occupational equipment.